One of the biggest concerns after a surgery in the prostate area is erectile dysfunction or sexual function issues. And Carl went through this procedure, and I want him to tell you his experience regarding TURP and also enlarged prostate. Carl, tell us what led you here in the first place.
Um, I had real difficulty in urinating, especially starting. And then when I did start, it would dribble. I had almost no stream. It actually was like a spray. Most of the time, I ended up on my knees and my shoes and around the toilet. It was just very unsettling. Um, it finally came to a situation where I had to go to the emergency room because my bladder had backed up into my kidneys, um, and they found after urination I still had about 1,000 milliliters uh, in my bladder, um, and they put a catheter in order to drain that. Um, and so immediately upon discharge, I came to see Dr. Lynn, and his prescription again was to undergo this TURP procedure. My concern with the TURP procedure was, of course, having heard stories, and my father 60 years ago had the same operation and it left him impotent. And I was certainly didn't want that, but I was in a position where I couldn't urinate. This was sending me to the emergency room, so I had to have it done. Dr. Lynn said that he could uh, perform this operation and that I would have full sexual function, which happily I do. And so I am very thankful not only for Dr. Lynn's skill and his um, staff that has supported me through this, but it turned out wonderfully. I now have what I would call a better than normal stream for someone my age. I can empty now, and I just think it could not have gone better. And everything he said he could do, he did, and it works.
And that's one of the biggest fears for a lot of guys is change in sexual function after a TURP procedure. Sounds like you're saying that you are able to urinate better, and yet there's no change, no negative change in your sexual function.
Actually, the discharge instructions said that after a while that some patients had reported better sexual function, and I'm one of those that can absolutely declare that my sexual function is better than it was, say, a year or 2 years ago. I wouldn't say that I'm like a 40-year-old, but I'm close.
So you're one of the guys who experience improved sexual function after a TURP.
Absolutely, absolutely improved in every phase of my sexual performance.
That's great, and that's something to brag about at 76.
And I am. I'm crowing like a rooster.
And what was the analogy you said? You have a
Oh, when it comes to an erection, I can pull a boner a cat couldn't scratch.
I've never heard that one.
It's true.
So that is wonderful. The other thing guys are worried about is urinary incontinence, not being able to control their urine after a TURP.
Have not had one bit of incontinence. I was wearing diapers, adult diapers to bed, say the 90 days before this operation, and I'd never had incontinence before. That should have kind of keyed me in, but I would just thought it was part of this procedure. I have absolutely no incontinence anytime, even if my bladder is full, uh, uncomfortably full.
Sounds like you still have full control, improved urination, and improved sexual function after TURP.
I do. I do. And I'm grateful to you. Thank you.
That's remarkable. That's remarkable. Now, what would you tell guys who are suffering with enlarged prostates?
Get it done. Uh, and I, of course, the only urologist I've ever seen is Dr. Lynn, but he absolutely came through with everything he said he could do um, in treating this enlarged prostate. And so I would recommend, if that's the state of the art, don't wait until your urine backs up into your kidneys and
Yeah.
you end up in the ER, which
Yeah.
I did. So
The couple of other things that guys are concerned about after after a TURP are, well, actually, do I have to wear a catheter, and also how long do I have to stay in the hospital? What was your experience?
This was outpatient surgery. I went in about, I think it was about 9:30, 10 o'clock in the morning. I was home by, I think, 1300 hours in the afternoon. He said if things went right, depending on how much bleeding there was, that I might be able to go home without a catheter. And he made good on that too. I left and went home without a catheter. Post-op said that I would have some blood in the urine and maybe a little pain. I'd say on a scale of 1 to 10, the pain, even the first couple of days, was never more than about 5 or 6. And that only lasted at initiation of a urine stream. Once I got going, it wasn't a problem at all. So again, if you're worried about pain or that sort of thing, I would not put this off based on at least my experience with it.
Well, it sounds like you gave a pretty darn comprehensive account of what a TURP patient goes through. So I really appreciate that. You noticed an improvement in your urination. How has this TURP procedure changed your quality of life?
Well, obviously, I can go places now, go out to dinner, get in the car, and drive for some period of time without having to stop 2 or 3 times, because before uh, I couldn't empty, even if I would go in 15 or 20 minutes, it felt like I hadn't relieved myself at all. And I'd have to go again. And that went maybe 2 or 3 times until I could empty sufficiently to go maybe, again, depending on intake, for an hour, hour and a half, and then that would start all over again.
Sounds like you are now controlling your life instead of having your bladder control your life.
Yeah, that's accurate.
All right. Well, thank you so much for sharing your story.
Thank you, Dr. Lynn.